Hello everyone, my name is Chuma Msindo and I'll be giving my talk on the importance of music for children and the role of music therapy in school. Just a little bit about me. I am a graduate from the University of Pretoria with a master's in music therapy. And over the course of my studies, my drive has been to provide a creative and safe space for someone to express themselves and in the process help to improve their mental health. I am an open-minded individual, and as a student intern, I've worked in different contexts such as a hospital, psychiatric hospital, old age home, remedial school, children's home, and now currently I work in preschools. With my vested interest in mental health and providing a means of communication for those who find it difficult to express themselves through words, my goal is to offer the affordances of music therapy to any client group in need. What my presentation will focus on is introducing you to what music therapy is and my work with children. Therefore, I'll be showing some excerpts from my sessions, and at the end, I'll provide information as to how you can contact me for any questions that you may have. So, what is music therapy? The current working definition for music therapy is that music therapy is a reflexive process wherein the therapist helps the client to optimize the client's health using various facets of music experience and the relationships formed through them as the impetus for change, by Brisha. So music therapy is a well-established healthcare profession registered with the HPCSA or any board that's certified in a country, which is in South Africa the Health Professions Council, and it forms part of the art therapies, which includes art therapy, drama therapy, dance, and movement therapy, and as well as music therapy. So it involves clinically informed music-based interventions used to achieve therapeutic aims. Music therapists work in different settings, including hospitals, private practice, schools, old age homes, in palliative care, and children's homes. And there's more placements that they work in as well. And so just as you're listening, I want you to just take a moment to reflect, how does music impact your life? And that can be a rhetorical question. You can explore it just to see. But definitely think about how music has impacted your life. Which brings me to asking, why music and music therapy? Music is often the first thing to which a child relates. Think of a parent or a guardian singing lullabies to their babies. There's a really beautiful story about how the people of Kantong in northeast India compose a short song to act as a name for their child, which is quite a beautiful tradition. And so it builds upon this relational way that people can be together. Music is a motivating, engaging, enjoyable, flexible, adaptable, and non-invasive medium that stimulates all of the senses. It involves the child at many levels, addresses several needs simultaneously, and most people, especially children, enjoy music. What does a music therapist do in a mainstream school? Well, we provide a unique variety of music experiences in an intentional and developmentally appropriate manner. So music therapists work in a wide variety of settings, as I said, schools being just one of them. And the focus of music therapy at Hatfield Montessori is providing a unique variety of music experiences in an intentional and developmentally appropriate manner to effect positive changes in children's behavior and facilitate the development of their communication, social/emotional, sensory motor, and or cognitive skills. A variety of process-appropriate techniques are used to achieve the program goals, Such techniques include actively involving the children in singing, music listening, moving and dancing, dramaticizing, instrumental playing, and improvisation on easy-to-play instruments, and in other creative activities such as art making and songwriting. Group music therapy at Hatfield Montessori involves the functional use of various musical interactions to enhance socialization, pre-academic learning, communication and language, creative and constructive self-expression, healthy social emotional skills, and sensory motor skills. As well as basic music education and appreciation is also built into the group music therapy program as an additional musical outcome. And so far we've had 6 sessions, and so I will be showing you excerpts from some of these sessions. In my first excerpt, we're going to be looking at routine and rapport. So the greeting song. And that can also be applied or applicable to the goodbye song. The greeting song initiates interaction and participation. When we use movement, instrument play, or a thumbs up/thumbs down check in greeting, it starts the group on a positive note and encourages participation from each child. It is a great way to assess the group and to check in with the children and see how they are doing. This might be done by singing to each child individually or by observing each of the children while we sing to the whole group. This routine helps us to build rapport and trust with the children.
We all say hello in a funny way. We all say hello in our own way. We all say hello in a funny way. We all say hello in our own way. Now clap, 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 and stomp, stomp, stomp. We all say hello in our own way. Now I'm going to say hello and you copy me, okay? Hello, that's my hello. What is your hello? Hello. Hello. What is your hello? What is Francis's hello? Are you done yet? Hello. Hello. How do we say hello, Uganda?
In the second excerpt, we'll be looking at instrument use, singing, and improvisation. Music therapy sessions in preschool settings often incorporate some type of instrument for the children to play in each session. Creating music helps children develop motor skills, learn literacy and numeracy, and develop creativity and social emotional skills. The child's creativity naturally shines through as they play and explore in their own ways. So their motor skills get a boost as they learn to keep the beat, start and stop, and use their hands and bodies in unique ways. Their listening skills are enhanced as they balance creating their own sound, while also paying attention and listening to their peers. Improvisation is how we can climb into their world using our imagination and still keeping in mind the goal of the session.
And you go fast. And you go. We're gonna stop and play and stop and play and stop. We're gonna hit our sticks. Hit our sticks. Now we're gonna hit different rhythms and we're gonna follow that person's rhythm.
The last excerpt we're going to look at is movement and relaxation. We also work on impulse control with start and stop games with instruments or freeze dances to help them practice stopping their whole body in response to a cue. This improves the child's ability to follow instructions that will help keep them safe, such as responding to the word stop if they are in an unsafe situation. I like to make use of scarves and partner work in my sessions, and scarves because of the visual stimulation, and doing partner work helps to encourage the children into increasing the proprioceptive input. So that is sensory information that is sent to the brain for body positions, movement, and force. And it is good for grounding, emotional regulation, and coordination. And through partner work, you encourage the children to see each other and therefore drive empathy.
Scars up, scars down, scars up, scars down. Turn around and round and turn around and round. Scars fly, scars across, scars fly, scars across, scars fly, scars across. And you crumble into the tiny little bone. Until you think they're lost. Oh, wow. Where'd they go? How you gonna find them? You're gonna shake, shake stars. You're gonna shake, shake stars. You're gonna walk with your stars.
And so some of the goals that we're working on is social interaction, which is promoting and improving social skills. There are developmental goals, so increasing opportunities for cognitive, physical, and sensory stimulation, promoting and enhancing fine and gross motor skills, promoting speech and language skills as well. And there's relaxation by using grounding techniques and music listening, as well as creative exploration. So that's encouraging creative, constructive, emotional self-expression and boosting self-confidence. What would individual music therapy look like? So an individual music therapy process would involve a referral from within the school team and in agreement with the parents or guardians, it'll be supplementary to group music therapy. These services are provided privately and billed for as such and are provided at the school. Individual music therapy is usually a short-term therapy intervention consisting of 6 to 8 sessions. Each individual therapy program is coordinated to support and or complement therapeutic goals and needs already identified by other professionals, parents, or the school team. During assessment, I would explore which style of music, techniques, and instruments are most effective or motivating for each individual child and expand upon the child's natural, spontaneous play to address areas of need. I would develop a rapport with the child, which is key, as the therapeutic relationship is a space within which goals can be addressed. I would clinically observe and interpret the child's musical and non-musical behavior and interactions and assess their communication, cognitive or academic, motor, social, emotional, and musical skills. After developing realistic goals and target objectives which align with and or complement other existing therapy goals outside of the music space, I would plan and implement systemic music therapy treatment programs with procedures and techniques designed specifically for the individual child. And then progress is monitored and reported on in consultation with the parents. So typical individual music therapy goals in a setting such as Hatfield Montessori may include developing a child's self-awareness and confidence, readiness skills, coping skills, and social behavior. We would look into developing and improving speech and language skills and communication in general, developing and strengthening fine and gross motor skills, increase opportunities for cognitive, physical, and sensory stimulation and integration, promote and provide opportunities for creative, constructive self-expression, and finally, provide a highly motivating and playful medium for managing pain and stressful situations, especially in younger children who may not be able to access verbal counseling and need a safe environment to express their emotions. I thank you all for your time today and for allowing me to impact your child's life with the unique magic of music. If you have any questions, my social media details or my contact details will be provided. Thank you so much.